Today's topic is about nutrition. The nutrition, although holds an important role in human normal physiology, and as a part of NMC curriculum, very often few questions are asked from this chapter, very often. So one or two you will be definitely getting. One very important question I can mention here, that is the Kwashiorkor and Marasmus and their symptoms. Yeah? So this is very important question. Another question is metabolic syndrome, obesity. A part of this chapter also implies formation of a diet chart of a normal person. Usually, the abnormal or the diseased person diet chart is not often asked. You should know about the certain terminologies about this chapter. You must have a clear idea about food, nutrition, components of food, nutrients, diet, etc. What are the differences between them? Right? So, as of now, food are classified. Mostly these all informations are taken from the community medicine book of Park. Okay, mostly you'll get from there. So, food can be classified based on their origin, their chemical composition, their function, and their nutritive value. Okay. So, what is the food? Food is something which we consume to harness energy and proper nutrition. Proper nutrition. Then what is nutrition? Nutrition is a sum total of all inorganic and organic components found in, right? They are called nutrients. Nutrients. And these nutrients provide an holistic approach to the formation of human body. That is called nutrition. That means the inorganic and organic components and their interactions with our normal health is called nutrition. Whereas food is something which we consume. So, for example, if I ask you, do you consume carbohydrate? Do you consume protein? Do you consume fatty acid? Or you consume bread, butter and pulses? Which one? So, you consume food and you get nutrients. The effect of consumption of food in our body is nutrition. Clear? So, we do not consume nutrients, we consume food. The food contains nutrients. It may not. Some food are good, some food are not. Say for example, ice cream. Yes, but does it comprise the holistic nutrition of the body? No. Right? Right. So, classification by origin. Some foods are of animal origin, some foods are of plant origin. Animal origin mostly are protein in nature. They contains less carbs, carbohydrates, more of protein and fat. The animal fat, the solid animal fat, otherwise called lard, L-A-R-D, lard. The vegetables, vegetable origin means what? What do you get from vegetables? Do they provide energy? No. But they provide bulk of vitamins, part of minerals. Right? Classification of by chemical composition. So there are 5 elements: carbohydrates, proteins, fat, vitamins and minerals. Okay? These are the components of food. Chemical composition. As per their function, the food has basically 3 functions in our body. The body building foods which are required for formation of body components. Energy giving food, patient is not growing and not at growing age. Suppose our age, but we need energy to perform. Then protective foods. Small babies, they get these elements from their mother's milk. Correct? When we are grown up, we consume other vegetables, fruits to get the vitamins which are required for the protection from other diseases. As per nutritive values, some foods are rich in carbohydrates, some foods are rich in protein, some foods are rich in fat, some foods are contains only animal products, some foods contains fats and oils, sugars and jaggeries. Some food contains condiments and spices. What is condiments and spices? Yes, turmeric, coriander, all these we consume as a part of the curry. Tadka on dal or masalas from biryani. What do they do? Some has protective function, some has something called taste enhancing factors. We add condiments and spices to just enhance the palatability of the food. You add some food spices to the canteen food, it becomes your homemade food. What we miss for always. Nutrients can be divided in two parts, macro and micro. Magnesium, macro or micro? Macro elements, micronutrients. Example, vitamin A, micronutrient, vitamins, micronutrients. Minerals, few minerals are micronutrient, few minerals are macronutrient. Minerals which are required less than 100 grams per day, they are called micronutrients. Okay? Now, how do we estimate the calorie? Calorie means energy. 1 calorie by definition from your 10th standard book is the amount of heat required to raise the temperature of 1 gram of water by 1 degree Celsius. By 1 degree Celsius. But in biological system, this much calorie is very small unit. So we consider, in biological system, we consider 1000 calories equal to 1 biological calorie. We consider 1000 calorie is equal to 1 biological calorie. And this biological calorie is expressed with capital C. Whenever you get something written in capital C, understand that is biological calorie. 1 calorie, capital C, is equal to 1000 small c calorie. 1 kilocalorie. 1000 calorie is equal to 4.18 megajoule. Megajoule. So this much calorie. Suppose how much calorie we require? We don't calculate. How would we calculate? We need some unit. So this is a unit. Either megajoule or kilocalorie. Have you heard of this term? Respiratory quotient? Are you aware of this? What is that? The same thing. You must be aware of these terminologies. Nothing new I will teach. I will just tell you what are the short questions they ask from here. Sometimes you might get very easy question, but because you forgot, you cannot answer. Just respiratory quotient. That means the amount of carbon dioxide ratio of amount of carbon dioxide produced by amount of oxygen required to oxidize the food. It's called respiratory quotient. Lowest and highest respiratory quotient of food is what? Carbohydrate is 1 and protein is, fat is 0.7. Okay? So which one requires less oxygen? Carbohydrate. Which one requires more oxygen? Fat. Which one is in between? Protein. Now, on an average balanced diet, the RQ is around 0.82 to 0.85. 0.82 to 0.85. You have to maintain around this respiratory quotient. If this is maintained, that means the person is taking almost a balanced diet. If the RQ is more towards 1, that means the person is taking mostly carbohydrate-rich food. If the RQ is much below 0.8, that means the person is taking mostly fatty food. Okay? So fatty food we have to take a lot to get 0.1 energy, 1.0 energy, means more fat we have to consume, but we will get less energy. BMR. What is BMR? Probably you know. Is there anyone who don't know BMR? 12 ঘন্টা পরে 12 hours from a normal meal. খাবার খাওয়ার 12 ঘন্টা পরে completely physical and mental resting condition এ, তাহলে mental and physical resting condition এ যে minimum amount of energy তৈরি হয় per square meter body surface এরিয়াতে তাকে বলা হয় BMR, the minimum amount of energy produced by per square meter of body surface area in a complete mental and physical resting condition after 12 hours from the last meal in awake condition. After a good night's sleep, morning when you get up, then you wake up but don't get up. Measure BMR. What is the instrument? Benedict-Roth instrument. Now, Benedict-Roth. So, using that instrument, you can measure BMR. Is there any other way to measure BMR? Very simple, using a thermometer, clinical thermometer. Normal body temperature. How much is our normal body temperature? So, if the temperature is more than 99 or near 99, then BMR is high. If the temperature is below 98, BMR is low. And this particular shifting of body temperature, BMR, or this body temperature, signifies which disease? Low body temperature in the early morning signifies which condition? Hypothyroidism. Hypothyroidism. So in hypothyroidism, what will be the level of primary hypothyroidism? What will be the level of TSH? High or low? High or low? High. I said primary hypothyroidism. If it is secondary hypothyroidism, then TSH would have been low. Good, very good. So if it is higher, that means it's having hyperthyroidism. Thyroxine T4 is more. Metabolic rate during sleep is less than BMR. Oh, what is the function of this amount of energy required? For what? For maintaining the normal heartbeat, respiration, diaphragm muscle movement. As per the age group, as per the ICMR, BMR is normally like this. So what is the normal? For male 2100, for female average 1700. Factors affecting BMR. Factors affecting BMR. Now, the next thing I will ask, what is BMI? What is BMI? Whole class together. What is BMR? Why? Am I mad? I'm asking you a very simple question. Who will মানে তোমাদের মধ্যে কারা কারা ভেবেছো যে এটা খুব সিম্পল কোশ্চেন টু আস্ক? Very few answered body mass index. Don't think you are smarter than them. What happens if you are out of touch? If you are out of touch of a subject for a prolonged period, this happens. Except body mass index, they wrote everything. Body muscle index, blood muscle index, body muscle impulse, everything. So many terminologies, except body mass index. Basal metabolic index was 50% of the students answered basal metabolic index. What is the unit of BMR. What is unit of BMR? Calorie per kg body weight per day. Correct? BMI I will come later. But these two terminology is very, very confusing. I don't know why confusing, but I found it confusing from the student's answer. Factors affecting energy requirement. How much energy actually we require to survive? It depends on the activity we perform, the metabolic state we are in, and the type of food we consume. Suppose we are all consuming balanced diet, then the difference due to food is ruled out. What is left? These three terms. One is physical activity ratio. It is very difficult to calculate. And this physical activity level. And last one is total energy expenditure, TEE. Now these three terms we should know. First one is very important, physical activity ratio. Why it is important? Because most of the ICMR documents showing or depicting the calorific requirement of an individual in the locality served by you as a community doctor are given on the basis of this calculation. Unless your feedback comes properly with the calorigenic derailment of the population served by you, a wrong information will be conveyed to the center, and the government of India will decide the diet of an individual in a different way. So, role as a community medicine, this is part of community medicine, the role of a doctor is also there to determine the proper diet of an individual area, locality where you are serving. If you are serving in Darjeeling, it's different. If you are serving near Digha, it's different. If you are serving in Pune, it is different. If you are serving in Arunachal Pradesh, it is different. If you are serving in Thar, it is different. If you are serving in Machilipatnam, it is different. Right? So, such a diversity of India, this is also an important job of a medical practitioner to find out the local dietary requirement or energy requirement. That's right. So, calculation is done by energy cost of an activity per minute, by energy cost of basal metabolism per minute. I give you one very easy example to understand what is PAR. Suppose I am working in a post office. Okay. Morning when I got up, my BMR was something. Fine. Now when I am working in the office, what is my work? To put a stamp. Right? Suppose whole day I am doing this work only. Fine. Another guy got up in the same place, my brother. Consider my brother of same mother and parents, same parents. He works in a workshop, metal workshop. He does the same thing, hammering, but with a 5 kg hammer. Right? So, the requirement of energy by me and him will be different. How to find out? So, per minute activity we must find out. Per minute. And suppose I am working for 8 hours and he is working for 4 hours. So, I am working more or he is working more? How do you know? So that is the basis for calculation of requirement of energy. Fine? Now, physical activity level. There are mostly 3 levels: sedentary, moderate, and heavy workers. Sedentary means lazy jobs, sitting job, lying job. A fractured patient. What is the job? A leg fractured patient. What is the job? Lie down. It's a lying job. Not saying lies. Lying job. Right? And one cyclist. Moderate or heavy worker? Heavy worker. A miner. Very heavy worker. A rickshaw puller. Not toto puller. Rickshaw puller. Paddle rickshaw. Heavy worker. A medico, like you. A medical teacher. Sedentary. Your father working in an office. Sedentary. Who gets more care? The sedentary worker gets more care. Am I right? The sedentary worker gets more care in house by a moderate, heavy worker slave. Right? So this is how. So whenever a person comes to you about the diet chart formation, synthesis, formulation, these things you must have. So if you have sedentary level, resting 1, sitting 1.2, standing 1.4, light, slowly walking 2 to 2.8, light household work 2 to 3. So your father's PR value is 1.2, your mother's PR value is 2 to 3. Moderate and heavy worker, brisk walking, heavy, manual labor, swimming. The PR refers to a single specific activity, as I mentioned. Suppose in my 8 hours duty period, 3 hours I was sitting, 2 hours I was doing this, right? And 3 hours I was sleeping. Don't we sleep at office hours? We do. Yes. So we have three different PR for each period of working period. It's not like that, oh, what do you work? Like that, no. How many hours you work in this way, how many hours you work that way, how many hours you work this way, like that you have to calculate. That's why PR keeps on changing of a nation's population based on their economic integrity or condition. In India, you forget. You go abroad, say Middle East, the oil yielding countries, whichever country you want to take, you can take Qatar, whatever country you take, any country. There, most of the laborious jobs are done by non-Arabs who are not from that soil. So when you are making a diet chart of a person residing in Kuwait, if the person is Indian, his diet chart will be different than his boss. Correct? It's not about ethnicity, about the economic condition, gradation. Physical activity represents average ratio over a full 24-hour period. PR কি বললাম প্রত্যেকটা পিরিয়ডে আর পিএলটা কি হচ্ছে অ্যাভারেজ আউট অফ হোল ডে, রাইট? SDA, the thermogenic effect of food. After consumption of some food, we feel warmth, right? Energetic. Say for example, after taking a plate full of biryani with a Coke, what do you feel? You feel hungry? You feel content? You feel energetic? What? Content, energetic, correct? Means now you can work more. No. After taking biryani with Coke, you don't feel energetic to work more. You feel, right? Why? But if you take 2 chapatis and 2 portions of dal and 1 vegetable, after that you feel energetic. Correct? Because the fat you consume, that might give you more energy, but at the cost of taking more energy from your body during digestion. Carbohydrate, on the other hand, will produce more energy instantly, but fat will require later. It will get stored first, then if you require. Suppose now you don't feed me for 7 days, will I survive? Yes. Correct? But many of you may not survive. Why? Reason you know. Correct? So fat is utilized by whom? The people who have trained their body to utilize fat. So for example, athletes, Michael Phelps, he used to take 3 whole chicken, 24 or 30 some number of eggs, a bowl full of butter, and till date he never had heart attack. He used to burn the energy during swimming practice. And what we do? We store the energy. We do not burn it. A regular runner has trained his body to utilize more energy more efficiently compared to an amateur or amateur runner. An amateur runner is untrained. A trained runner can utilize energy more efficiently. So, 2 pathways work in their body more efficiently. One is beta oxidation pathway, another is TCA cycle. Depending on your physical activity, SDA might change. What is that? If you are walking, you burn out 140 calories. If you are swimming, see the speed. Not a very high speed, normal swimming, 550. If you are running, 490. Typing at very fast rate, then 100. Walking, brisk walking, 140. So these are the energy above SDA. Means if you are working, then you have to add this much amount of energy over SDA. SDA means what? The energy which is lost during digestion and absorption of that particular food. Now, if you suppose you want to walk, that means you have to get energy for 140 calories plus the amount of energy lost in the form of SDA. Be it X, so 140 plus X. That much energy is required if you are walking. If you are running, you require 490 calories plus the SDA of the food. Suppose you are taking pulse and chapati, your SDA will be less. You are taking biryani with mutton, fatty mutton or piece or something like that, then your SDA will be high. Like that. So these are factors you must have. For sedentary worker, on an average, roughly you can add 30% of BMR. For heavy worker, 50%. For moderate worker, in between. Of BMR. And that much amount will be increased. Requirement will increase. For pregnancy, just plus add whatever activity you are adding, to that you add 300 calories per day. And during lactation, plus 500 calories per day. Suppose normally if someone is having 1700 BMR, correct? So how much you should get for diet, we'll see that. Calculation for energy requirement. For BMR, 24 into 50, for a 55 kg person doing moderate work. See how we are adding for total amount of calorie requirement. For BMR, 24 into 55, 24 calories per kg per day. So per kg means 5 kg weight, just multiply, you get 1320 kilocalorie or megacalorie, capital calories. So for activity, add 40%. If it is a moderate worker, 40%. So 40% of BMR you have add, 40% of BMR you add, what was it? 528. Subtotal it becomes 1848. Need for SDA, 10% on an average. On average, 10%. So just add 10%. This much, it becomes 2032. So that becomes the total requirement. The nearest full value, whole number is 2050. So this much amount is required. Now calculate for you. Calculate for you. For you, what will change? What will change? Body weight. And what will change? What is not mentioned here? Height of the person. Considering it is having normal BMI less than 23. Your BMI, if your BMI is high, then your requirement will increase. That means same weight, different height will require different calorific requirement. Same weight, different height. With my height, my weight, fine. With my weight, half of my height will require more amount of energy. Because weight is more, height is less. So BMI is much higher than me. So BMI more means what? What is more? What is the difference between me and this fellow? Come on. Me and this fellow. What is the difference? I am fat, he is lean. Fine, thin, okay. What is major difference in our Excel numbers? Which portion is more in my body? Except fat? Anything else? Which fat? What comes more? With fat, surface area increases. What is BMR? Per kg. So per kg increases. What is BMR? Per square meter. Energy production by per square meter of skin area. So my body surface area also increases. If my body surface area increases, what will increase? My energy requirement will increase. So when I reduce fat, I not only reduce my weight, I also reduce my body surface area. And sometimes if the BMI is more than a particular value, the reduction of weight alone will not considerably reduce the body surface area. The skin will become slack. At that time we may have to do some surgery to remove the excess skin, because without that our body requirement of energy will always be elevated. The person will never come to a lower calorie diet. He will always feel hungry. It's not his fault. Because his surface area has increased, that's why he is feeling more hungry. Okay? So beyond certain limit of BMI, it becomes irreversible. Although you reduce weight, you cannot reduce the craving. So much of